a 3, 4. 2, a 3, 4.
Let's have time for our next candidate coming here, and we now have Robert Hyde. And please come up and join us, Mr. Hyde. Just get right over there, come and take a seat. Great to see you. You'll have a handheld microphone, so thank you so much for coming. So good to see you. Thank you. Appreciate it. I'd like you to take about 5 minutes to just tell us a little bit, introduce yourself a bit, and also tell us about some of the issues that you see for people with the disability community.
Thank you so much. Good afternoon, everybody.
Oh, let me just say one thing that I forgot to say, because I'm really interested in this. You're the founder of a new party, new to me anyway, Cheaper Gas Groceries Party. I love that. Maybe you can start talking about that just a little bit. I'll have my comment.
Yeah, for sure. I started a new party this year, third party. It's called Cheaper Gas Groceries Party. By law, you're allowed to have 3 words. I chose those 3 words because they represent my conservative values. And what I feel we all need today is affordable groceries, affordable gas, affordable place to live. And I'm running as your third-party independent candidate for the state of Connecticut, U.S. Senate.
Interesting, and that's a steep climb to start a new party and then to run for one of the top offices in the Senate. So tell us a little bit about your urge to do this.
Yeah, for sure. So, my urge to do this was, I figured, with 12 years, or the senators combined 26 years in politics, that we haven't seen gas triple, food triple, housing triple, taxes triple, electric bills triple, conflicts around the world never being resolved. I figured I could definitely do a better job than the current senator providing a better economy for us, a better place to live, and maybe resolve some issues in the world.
Do you want to talk a little bit about some of the issues regarding people with disabilities, or can we just get into our questions?
Yeah, so I'm honored to be here today to discuss disability rights and policies that will shape a more inclusive future for all Americans. As a candidate for the United States Senate, I am committed to ensuring that people with disabilities have equal opportunities to thrive in our society. I'm committed to ensuring that people with disabilities have equal opportunities to thrive in our society. My policy focuses on 3 main pillars: accessibility, employment, and healthcare. Firstly, we must ensure that all public spaces, including transportation and buildings, are fully accessible. This includes not physical accessibility, but also digital accessibility, ensuring that all government websites and services are usable by people with disabilities. Secondly, employment opportunities must be expanded. This involves providing incentives for businesses to hire individuals with disabilities and creating robust support systems that include job training, reasonable accommodations, and anti-discrimination protections. Finally, healthcare services must be fully inclusive. This means addressing physical and mental health, ensuring comprehensive coverage that includes necessary aids and technologies, and removing barriers to accessible care. I am committed to working with disability advocates and experts to create policies that reflect the needs and rights of the disability community. Together we can build a better society where everyone can live with dignity, independence, and equality.
Thank you so much. Appreciate that. I understand that you are a Marine vet, that you are a data analyst and a GIS analyst. Tell me what that means exactly. I looked it up, but I'm still not sure that I really understand what that is.
That's great. Thanks for asking. GIS stands for Geographic Information Systems Science. So basically it creates maps and does data analysis with census data, time tracks, where we can put together maps to look at so-called food deserts throughout the country for hurricane damage, hurricane needs, and do projections on future events.
Very interesting. Mr. Hyde, Senator Murphy was saying, I think you might have heard at least part of his discussion with me. He was talking about misinformation about what's happening with the storms and about people who are questioning whether illegal aliens, as they're sometimes called, are getting free hotel rooms, cell phones, debit cards, while Americans are not in the areas that have been affected. I was looking at your campaign website. You did mention that, or one of your social media sites. You did mention that. Are you concerned about that?
I'm very concerned. I think we all should be very concerned how the federal government's addressing the needs of American citizens nowadays. They're only offering American citizens $750 from FEMA in disaster relief funds. They've been using a program under FEMA called Services and Shelters Program to divert over $800 million to illegal immigrants to placing them throughout the United States and giving them debit cards, telephones, housing, food. So I do believe if you look right now, FEMA is even turning people that were just trying to help people away. I think we need to focus our government, get it back on track to helping Americans. That's a huge portion of the FEMA budget's $1 billion going to illegal immigrants rather than the needs. To say that FEMA was out of money and they're going to be using SBA loans to satisfy people's reliefs is kind of embarrassing. I mean, these programs were set up, federal emergency management, to service people that are stressed out. I mean, these people have lost everything. And they don't even have internet to access to obtain that $750.
I'll ask you a little bit about a really big issue that's been happening. I first noticed it because I'm in the media. I first noticed that private equity firms moving into companies like newspaper companies and other media companies and buying them up. Okay, putting in some money that a lot of these companies needed, but also then kind of stripping them down, letting go of staff and stripping down equipment. And what's happening now is that this is happening with private equity firms in healthcare as well. In fact, we have an example of some small hospitals in Connecticut owned by a group called Prospect, and they have actually taken over some physician practices. The physicians, in part, like it because they see the possibility of getting out from underneath some of the hassles of insurance, but they give up a little bit of control over their practices. And the concern now is that once these private equity firms come in, they're trying, obviously, to maximize profit, that's their job, and they are stripping out equipment from places like hospitals, they are hiring people who are less qualified, they are taking away some of the services that some people with disabilities need because they're not profit centers. What do we do about this? Is it hurting our healthcare system, particularly for people with disabilities?
Yes, I think it's hurting everybody. We've seen all hospitals, including the VA, have gone down the tubes by letting private equity companies strip and the media companies strip, maximize profits and strip the services provided. I do believe we need some oversight in these arenas, for sure.
Yeah, I think in the Prospect case, I believe the hospitals were about to be purchased by the Hyde system, and then when the Hyde auditors went in and looked it over, they saw so many things missing that had been there when they had made their offer that they had pulled back, and that was a big legal thing going on. So really of concern, because it could cause those small hospitals to go out of business, which people need in those areas, obviously.
Yeah, for sure. I believe we saw Denver Hospital about to go out of business right before the CARES package came in. So we do need to address these and do some better oversight, government regulations on behalf of us to make sure that we have accessible health care and services provided to us, for sure.
Mr. Hyde, I want to ask you a little bit about, this is a question about painkiller medications. Obviously, there have been efforts to really control, and I know you're concerned about this too, to get painkiller medications that are being abused out of the hands of people who become addicted and no longer need the pain medications, or maybe never needed them for pain, but got addicted to them. Part of the problem, though, with cracking down is that sometimes that takes pain medication away from people who really do need it. People with disabilities, people, including people who have sickle cell disease, who have continual pain and need these drugs. How do we crack down on the illegal use, but still make sure that the people who are legitimately needing it get the drugs that they need?
Great question. So I think we really got to tackle the people that are abusing the system and enforcing the laws better. The people that need drugs, obviously they need the drugs, and there definitely should be reasonable access to the drugs they need. So I think if we just address people that are abusing the system and maybe prescriptions, definitely tackling the fentanyl situation across our borders will definitely help.
One of the things that is a big issue here is that we have 5 centers for independent living in Connecticut, and one statewide independent living council, one of the sponsors of this event. Each of these state centers is really a particularly good place for people who have disabilities to live because they are run by and for people with disabilities, which clearly is what all of us would want in whatever house we're in. But they have core services that they have to provide so that people can have good lives there in this community. And so in order to get federal funding, they need that these core services have to be provided by each center. Okay, all sounds fair. But what's been happening is that the core services have been increased while the federal funding has not. What do we do to make sure that we still have this type of housing for people in Connecticut? Because it's really becoming so tight that it's very hard for people to move into these places.
That's a great question. So we have to increase the Medicaid funding through the federal government. I believe $20 billion, roughly $20 billion annually comes from the feds to the Connecticut budget for the census. I believe that the last state is $3,800 per person is the budget that we receive from the feds. So I believe we need to increase that to provide for people that have disabilities for sure. So I believe right now the Centers for Disabilities and Diseases gets about $1.5 billion from out of the Connecticut government every year from the feds. So the budget does actually come from the federal government for Connecticut to provide for CDD and CCDD and all that stuff. So I believe we need to increase Medicaid to help address a lot of these issues here. I think we can do that in a bunch of ways.
You talked a little bit about how you would like to increase employment across the board, but you did mention increasing employment for people with disabilities so that they can also earn a living in the same way that everybody else does and have fair employment, okay? So there's been an issue because the Fair Labor Standards Act authorizes employers to pay sub-minimum wage to workers who have disabilities if it impairs their productivity for the work they perform, judged by the employer. So through the issuance of these certificates called 14C, employers such as shelter workshops, which used to be almost the only way that people with severe disabilities were able to work, but we've gotten away from that now, but it allows employers to pay a lot less money than they would pay to a person without disabilities. For instance, 25 cents an hour or less, which no one else would accept. So that's a sheltered workshop model. What we want to see is more people being able to work in regular organizations the way everyone who doesn't have disabilities does, and to be supported in the ways that they need. So there's an act now called the TIME Act, Transformation to Competitive Integrated Employment, that's in Congress right now. Would you support that act and oppose bills that would perpetuate sheltered workshops and other sub-minimum wage employment?
That's an interesting question. What's your stance on that question?
I came up in working with the disability community when sheltered workshops were really one of the only alternatives for people with disabilities, particularly with severe physical disabilities. And at the time, it seemed like a good idea because people were getting a chance to earn a living. But now, if people are allowed to, if employers in those situations can pay someone dramatically less than minimum wage, that just doesn't seem fair. That just can't be fair. And then how can people live independently, pay their rent, buy their groceries, all the things that you're talking about before? How do they do that? How do we allow employers to get away with that?
That's a great question. I'd have to become more. How does the audience feel on that question?
Get rid of 14C.
That's how the audience feels?
Yes.
That's the general consensus? That is with the audience?
Yeah.
I didn't think it was as easy as all that, because Beans Cafe used to be right outside my office. I used to go there once a week. Just make sure I go there once a week to help support them.
all these 14C certificates, and these organizations would like to see those eliminated. Connecticut has 24 agencies, 6 of which have pending 14C applications, and 18 have active certificates. So it's approximately 800 people that are served by these groups. But this conflicts with the home community-based services final rule, and this is, as you've heard, are keeping people who may be able to work competitively with other workers paid so much less than it's allowed to happen. What do we do?
That's interesting. I think every situation is unique and dictates. Perhaps her son still lives at home with her. He lives in one of those park facilities. So I mean, every situation I believe dictates whether, you know, maybe there's some kind of opt-in, opt-out with employers. Maybe there's got to be some kind of fine line. I mean, I hear some of the audience say they would like to get rid of the program. You would like to maintain the program. So I believe also the 14C program is a state program, correct? So I don't believe that resonates on the federal level, and I think, excuse me? It's not a federal program, I believe. It's state, I believe, because I believe there's states that do not. Did the state vote to maintain it recently?
14C certificates? Were they voted on recently to be continued? No. Okay.
So anyways, with that, thank you all. I believe if we do stuff in regards to deport illegal aliens, get rid of these sanctuary cities, and get rid of democratic policies and procedures that have definitely hurt all of us, and you guys vote differently this cycle, I believe we can do something. $1.5 billion a year goes towards illegal immigrants and their abuses on our social programs. I believe if we get rid of the illegal immigrants, we'll have plenty of funding to be able to increase Medicaid and help accessibility to everybody.
Mr. Hyde, thank you so much. This is Robert Hyde, who is the founder of the Cheaper Gas Groceries Party. Good name. Thank you so much.